In this video, I'm going to explain when to issue an ABN, an Advanced Beneficiary Notice of Non-Coverage, to a Medicare beneficiary. An ABN only gets issued to a Medicare beneficiary when normally the services would be covered by the Medicare program, but under this circumstance, you feel the Medicare program would not reimburse for therapy services. So what could be some examples? Well, an example would be when a Medicare beneficiary is receiving home health services. So maybe they have a nurse coming in, but they also want to come see you for outpatient therapy services. The Medicare program does not reimburse for outpatient therapy services at the same time they're receiving home health services. So that could be a time to issue an ABN. Also, perhaps, your Medicare contractor maybe covers iontophoresis as an example for certain diagnoses, but this patient does not have one of those diagnoses, but you still think ionto could benefit the patient. This could be then another example when to issue an ABN. A third example, if you look at CPT code 95992, this is caliph repositioning, such as the Epley maneuver, the CMOT maneuver, where there are many Medicare contractors that may only reimburse for that CPT code for one of three diagnosis codes. H81.11, BPV right ear, H81.12, BPV left ear, or H8113, BPV bilateral. Let's say this patient you're seeing does not have one of those three diagnoses. You want to use dizziness or vertigo, but yet you still think caliph repositioning could benefit that patient. So again, nationally, the Medicare program does reimburse for 95992. Your Medicare contractor only reimburses for it for certain diagnosis codes. This patient does not have one of those diagnosis codes. That would also be an example when you issue an ABN. You do not issue an ABN when the services are never ever covered by the Medicare program. So an example of that would be the patient's done with therapy. They've met all their goals, etc. But maybe they want to come back and still see you, and you want to provide these post-therapy exercise programs, fitness programs, Pilates, yoga, things like that. The Medicare program never ever reimburses for those things I just said. So an ABN is not required there. You could just have the patient pay you cash and go on. No ABN is required. Lastly, the ABN can only be issued to original Medicare beneficiaries. The ABN form cannot be used for Medicare Advantage patients or patients with commercial insurers. For much more information on the ABN, be sure to click the link below.